And we're on.
Alright. Hey, Gracial. If I mess up, we'll try to, y'all correct me if I mess up, that way
Okay.
the video will be good. Alright, so I received my physician's order saying that, what is his name? Paul can't go. That's what his name.
This is your physician's order.
So it says Paul can't go, needs a Foley catheter. Alright, so that's good. At this point, I will assess the patient for any allergies, like any latex allergies or anything like that, because that'll let you know what kind of gloves you're going to need to use. At that point, I'm going to gather my supplies, right? Okay, so I'll gather all my supplies, which basically for this is just going to be the bag with all your stuff in it. Go down to the patient's room, and I'll go in. Hi, my name is Ashley. I'm a student nurse from Georgia Southern, and I'm here to give you a catheter. I'm just going to verify your ID with 2 different forms. So you'll check his wristband, which on the chart says his number is blah, blah, blah. Double check with 2 forms of ID. He is who he says he is. At this point, I will go ahead and explain like the procedure to the patient. Let him know it's probably going to be uncomfortable, but I'll try to make it as smooth as possible. And I'm going to wash my hands. Some of this might be out of order. But
That's okay, that's okay.
I'm going to go ahead and wash my hands and put on regular gloves, which these, and actually put them on because I screwed this up on check off one time. Actually put the gloves on. We'll say that, we'll pretend like this is a wash basin.
Okay.
So I wash my hands and put on my regular gloves, and provide privacy. Because he's all exposed, so we kind of want to pull the curtain in case somebody walks up in here. Okay. Gloves are on. Here's my wash basin with soap. So for a guy, you're going to try to keep him, obviously as covered up as possible, just exposing the necessary area. Get my wash rag with soap and water. Grab the penis. And you're going to start from inner to outer. So get the wash rag, swirl around, rinse it, around, rinse it, swirl around again, rinse it off, and then pat him dry, because rubbing will probably irritate. So, and then he's clean, so you'll take off your gloves, put them in the trash, and then wash your hands again. After you've washed your hands is when we're going to start doing the whole sterile field thing. We're going to say I provide privacy because this curtain's probably going to get in the way of this whole thing.
That's a smart idea.
Okay. So pretend like the curtain is still there. Alright, at this point, we're doing our little sterile thing, and this is the part that everyone says they always mess up on, so hopefully I won't mess up too bad. Alright. Hands are washed again. You're going to open away.
Like the swabs that are ready like that.
And you can only touch the outer edge, like the outer inch of your sterile field. This way. And I like to turn mine. I don't like it to be like
Me either.
diagonal. Take the gloves, and you're going to put these on away from there. That way you don't drop things in.
If I were you, I would put them either somewhere where you can see them, because remember, you can't turn your back on the sterile field.
That's right. Okay, so big no, I just did.
Just pretend
so instead,
like,
I'll move this
because
stuff.
that wouldn't be there. Normally that wouldn't be there, so you could put them there. Yeah,
Okay.
that's what's messing. That was, you're fine, you're fine.
And that would have failed, so, okay, make sure you don't turn your back. Alright, you're going to grab under the flaps.
But you did fine.
Open up. Alright, and you're going to want to glove your dominant hand first. So if you're left-handed, obviously do that. I think Michael's left-handed, but I'm right. So you're going to glove the right hand first. This side is your right side glove. Since this hand is not sterile, you're going to touch the inside of the glove. Slide it on. Careful not to touch the outside.
Good.
Okay.
That's perfect.
Now that one's on. Since this is sterile still on the outside, it goes sterile to sterile. So you're going to have to touch the outside of this cuff, which is kind of difficult because I put these on so many times. So you're going to hold it like that.
Good.
And you slide it on like this. Careful not to touch. Alright, and I'm going to have funny fingers, I think, because
That's okay.
There we go. Alright, gloves are on.
So at this point, I'm just getting my kids together.
Now the gloves are on, you can mess with whatever you want, and make sure just to keep your hands above your waist. So, and as long as everything is staying inside of this area, you're good to go. This right here, I'm probably just going to trash it, so this will be my trash over here. This drape, I guess we'll drape it over the abdomen. And these aren't necessary to use, I don't think. The only one that you have to use is that fenestrated one. And it's shiny side up, right? Is it shiny side down?
I think it's shiny side down.
Okay. Touching the patient, the plastic touching the patient.
Yes. Okay. I think, well, let me ask. Is it shiny side up or shiny side down? Shiny side down. Shiny side down, yeah.
Alright, so shiny side is down?
So my balloons and plates.
That would, yeah. Or be under the patient for, you know, prevent the urine on the bed. But you did fine.
And now, I'm going to take this one. And this is the fenestrated drape. And you touch the outer edge of it. Okay.
At this point, the only thing that's left to do is for me to clean my patient. So I'm going to.
Oh, mercy.
See, because this penis,
yeah, he doesn't like.
I'm left-handed.
Just as long, I think as long as you
I mean, I can do it.
stick it over.
Because it feels weird.
Yeah.
I think that's good.
I'm going to start at the meatus and go around.
Yeah.
You know, a normal, I mean,
A normal one's going to kind of flop around.
Yeah.
But that just kind of, okay.
it's just kind of stiff.
And when I lose my hand, I'm going to grab it anyway and pull it
Yeah.
out. So, anyway. Alright, so now I can play with all this stuff in here. Put this in here. Go ahead and start organizing everything inside before you get started. The hydrogen peroxide, just go ahead and trash because you're not going to need it.
At this point, I am ready to insert.
Alright, here's the lube. Going to open that up.
Do we actually need to open up the lid for the
I don't think so.
I think we're just verbalizing.
Yeah, so squirt, squirt, squirt. Trash it. Iodine. And whenever you're checking for allergies, they might have an iodine allergy. So
she's going to provide.
betadine is what it is. And they'll have little swabs that have betadine in it. So you'll just say,
Do we need to demonstrate for Gracial how to do that? The swab?
you can be
I
like
think
my evaluator. So if you want to just like grab that plastic bag.
Yeah. Like, for instance, Gracial,
If they were allergic to iodine, you would ask your instructor, whoever is with you, to roll down the bag like this for you. And then they would hold it like this, and she would pull
swabs
in there.
a swab out for you. But if not, then you can just use your thing on the foot.
Okay, so here's iodine. Squirt that all over the cotton swabs and trash it. Careful to keep your hands above. Alright, at this point, I'm going to check the balloon and the catheter. So, take your syringe.
Here's the. I'm going to dispose of.
And I'm not going to do it all the way, but just simulating, you know, okay, I'm checking the balloon.
Clean my patient too.
And you're going to leave the syringe attached.
Make sure that the patient is in a safe position.
And at this point, you pull the catheter out like this, kind of keeping it in your fingers, that way it doesn't flip-flop all the way around and end up falling somewhere. Trash this, and you can set it in here, which is where the lube is going to be, so that way it's just chilling in there. And if the lube's actually in there, it'll probably help to hold it down, but I don't know. Okay, so once I've checked the balloon, at this point, you're going to lose a hand, right?
Outcome.
Is that right? Okay. So,
Say what?
you're going to come over here. I'm losing my left hand because that's my non-dominant hand. You'll grab the penis and hold it up. And you're going to take the cotton swabs that have the iodine on them. And for male, you'll start here, work in a circular motion from the meatus. Yep. Trash it.
Yeah. And normally the trash can will be there, so you could just drop it.
Yeah, because you're not supposed to like crisscross over your
Yeah,
sterile
never cross
field.
over the sterile field.
So make sure your trash can's close by.
Yeah.
Swab
Here, you can
again.
just pretend like this is the garbage can.
Yeah, that's just here.
Yeah. Because that way you want to cross
And you'll
over.
do it probably 3 times.
3 times max.
Out.
Or minimum, sorry, not max.
Alright, and then I'm going to go ahead and trash these because I don't want to put them back in my
Smart.
Okay, so now that I've lost my hand, I'm going to go ahead and correctly insert the catheter. And it's already lubricated.
And see, I don't think the catheter is not supposed to be attached to the drainage bag yet.
So it'll
But
be
ours-
easier.
But ours is, because then it says to attach the drainage bag.
Yeah, I'm probably going to do it like this. And do it that way.
Yeah.
So just kind of loop it, grab everything while you grab this. So, insert the lubricated catheter.
Yeah, this is
Alright, we'll just pretend like it's going down. It's urethra. And at this point, you're going to watch for the flow of urine coming out. Once you start seeing urine trailing into this, you're going to go in just a little bit further, probably another inch or so. And for males, it's probably going to be right up to this little eye thing right here. So we'll do that. At this point,
or just however you open
you're going to go ahead.
Whichever way you open it, I would put my
This and inflate the balloon all the way.
Miss Moore, can you come to us after you have? Okay, yeah, that's cool.
Okay.
I can never
What other drinks off? And I don't know if you trash this.
That's what I'm saying. Like, I don't know.
Because you're gonna have to use the same syringe to pull water back out, I guess. But I'm gonna trash it. Just
yeah.
Trash it.
Yeah, because we're not doing it. So I just get rid of it.
Yeah.
We're not doing.
And really, in a hospital, you can go get another syringe. So.
Yeah, and we're not doing anything with it anymore.
At this point, it's up in the bladder, and you'll give it a gentle tug.
Ow.
To make sure.
Yeah, here we'll just pretend like.
Yeah. So give it a gentle tug. Make sure that it's caught.
Yep.
Once you do that, you're gonna go ahead and take this bag. And hang it from the bed frame, not the rail. After you do that, you're going to take off your gloves.
Tape to the patient.
Oh shoot! Yeah, tape before you take off your gloves. Okay.
Tape
Gloves
it to
are
the
still on.
patient, then attach it to the bed frame.
Okay, so you inflate the balloon, give it a gentle tug, pull off a piece of tape, which I guess is a verbalized, because I think it's unverbalized on the checklist.
Yeah, because we don't know if they're even allergic to tape allergies or anything. We haven't done that.
Yeah, and for a male, it's going to be like lower abdomen probably. For females, it's going to be right on the inner thigh. Once you've taped it, you're going to take it, hang it on the bed rail, or bed frame, not the rail.
Yeah, you're fine.
You'll take off your gloves with the proper technique. Reach under here, pull them off. Those will go in the trash. Go ahead and wash your hands. At this point, for under the evaluation, you're going to document it and how it was tolerated, the procedure. Once you document, you know what time you gave it and how the patient took it. For evaluation, you're going to continue to come back and check the urine for like the consistency, the odor, the color, and whatever that means. I guess we'll know what that means eventually. And once you are doing the monitoring of the urine, you're just going to continue to monitor for any adverse reactions or anything like that in the outcome that you took, or the outcome and the actions taken.
The only thing that I see that we forgot, Gracial, and I totally forgot about this. When you're setting up your sterile field, in the book it says to go ahead and open this and gently put the top down so that if you did have to take a urine sample, you would just open this, put your sample in, and then, then you would close it after all that, because it does say, totally forgot about that.
And I don't even know if that's, because we're doing a Foley Cath, and that would be for like a sterile urine.
Yeah, because then down here it says, that's what it says. It says send specimen to the lab if ordered. That's why I was like, oh crap.
Yeah, so we might want to do that just in case.
Yeah, just in case.
When you're unpacking all your stuff,
slightly
take out this little cup, set it to the side, and just kind of go ahead and unscrew it, but keep the cap kind of loosely on, that way nothing gets in there. And if, and just let them verbalize, say, I have the cup doing this, just in case, if it was ordered for just a sterile urine specimen.
Because that's why they give us this thing, is because this thing is for the sterile specimen. Because then you would record that and tape it and let it know that, or put it on the bag or whatever.
Yeah.
That's what that is. I totally forgot about that.
Also, when you get done, make sure to clean up everything.
Yeah.
And, lay the patient down and leave them in a safe environment and all that stuff. So,
yeah, because
make sure to say that.
Everything was great. Miss Moore.
That's it.
All right, thank you.